Lovely to have you here for the interview. Thanks so much.
Thank you.
Maybe you want to say a few words, who you are, first as an introduction.
Well, I'm Giovanna Marsico, and I'm the director of the National Center for Palliative Care and End of Life in Paris. And in the past, I've been many years at the Ministry of Health in France. I'm a lawyer. I was a lawyer in Italy. I'm still a lawyer. And I've been for 8 years representative of patient and users in health system, also in France. And I created an association for promoting health democracy.
Wow, that's impressive. So many different aspects of it. So, I mean, you mentioned that you're a lawyer, or you are a lawyer. And what do you think, how can laws and policies foster better understanding and cooperation between different groups?
Well, as we saw during the different sessions here, we realized that there is a real democratic shift in democratic and demographic shift in Europe in this moment. And this demographic shift, which implies elderly problems and migration trends and vulnerable people and youth questions, all these different issues, they impact the economical, political and social landscape of Europe. And so healthcare system, they're also impacted from these questions. In the future, what we would like to have is a healthcare system which is equal, which is sustainable, which is honest, which respond to the needs of population. So if you want so, we need that population, all the different groups, they can be included in the shaping of this healthcare system, not just today, but for the healthcare system in 5 years, in 10 years. So inclusion of the point of view of people and of needs of these people, of underrepresented communities and groups, needs a method. We cannot just put people together and say, well, let us know your opinion. You need to work to accompany this situation. And there is method based on education of the different stakeholders, education of people, citizens, may also education of professionals, of technicians, of politics. There is question of framework such as equal access for everyone to services, health services, social services, so juridical services, justice, cooperation between professionals and patients and different stakeholders, so, and communication and information. And we cannot have all these results together if we don't have a real strong, solid framework which permits to have resources and to push people to bring this responsibility. It's not just a moral responsibility, it must be a social, political, juridical, professional responsibility.
Yeah, so I hear that it's also not enough to hold people accountable through laws and through policies, but also consider the educational aspect in it and how to communicate it, how to involve people in this. Correct?
Yes, of course. Yeah. If you want, I mean, we can bring the example of the individual relation between professional and patient. We are talking about health. So in health, we have a relation between two persons, so two two or more persons, concerning the journey of the patient. And we know, because research showed that when the patient is more concerned, is more informed, is more included in decisions that concern his journey, the outcomes are better and the trust is better. And there are methods. For instance, there is a clinical method, which is the shared decision-making process. But for realizing the shared decision-making process, it's not enough for the professional to be convinced that this is good. He has to have the tools and the formation, the education for this. And concerning the population, patients and citizens, so patients to be eventually, they need to be concerned about the importance of being included in decisions for the individual point of view and the collective point of view. This is democracy.
Yeah. And you also mentioned the intergenerational aspect.
Yes.
And the inclusion of young people, but also older people. I was wondering whether you can think of something where you would say there is a major shift you would like to see in public health policies, especially because you specialize especially in the end-of-life issues, considering the intergenerational relationships and the democratic aspect in it.
Yes. Well, the point of end-of-life and palliative care is very important because it is a very sensible question. It's really a personal but also collective question, and in many countries, this question have been led till now from professionists. It has been always a medical question, not a social. Or we know that end of life, it's a democratic question. How to ensure that every citizen, regardless his age, his gender, his situation, his origin, has a good end of life, and his relatives can have also the same experience, a good end of life. And this end of life is a question of being at home, is a question of having resources, is a question of choosing for the best end of life that we can wait for. So it's not just a question of clinical purpose, it's a question of social democratic purpose. Actually, in different countries, there are laws and frameworks, juridical frameworks, which guarantee the decision and the rights of people to choose how to live this last period of their life. They're not always, they did not choose the same framework, but what I think it's really necessary is to hear from people, to knowing what they want.
Yeah, and to recognize it across generations, correct?
Yes, yes.
So perhaps to conclude already, as democracies in Europe are now entering in this era of profound, especially demographic changes, why does it actually personally matter to you to be here at YFG and also discuss the participation aspect, because you have been involved in the session on participation particularly? It's been for me a real luck, a real chance to be here, because here it's a sort of platform which permits not only to inform
to learn from other countries, but to contribute to shape the vision of the future. And the vision of the future, it's not just the vision between technicians or professionals of the healthcare. It's a question of sharing the vision with people coming from other environments and other age. You talked about intergenerational. It's very rare for us who work in this field to talk with young people and to hear to what young people want for their future, because the world goes on, and the question that we are treating now will be the question which impact the young generation. So this situation, EHFG.
I have the same.
It's a very, very special place to build a good, honest, and equal Europe for everyone.
Thank you very, very much.
You're welcome.